I'm Ashley Payne, and I'm here to talk about paranoid personality disorder, or PPD for short. Have you known a coworker, friend, or family member that has trouble accepting any kind of criticism? And has that same person been known for blaming you or others for their own shortcomings? So that's one of the characteristics of someone who has PPD. So today I want to talk about the symptoms, some of the treatments, and the story of Mr. J and his diagnosis. The DSM-5 gives us a definition of PPD as a pattern of distrust and suspiciousness that others' motives are interpreted as malevolent. So in other words, these people have the thoughts and feelings that someone is always out to harm them in some sort of way. So there's no known cause, but researchers believe that factors contributing to PPD are biological, social, and psychological factors. And genetics also contribute to the paranoia traits. The American Psychiatric Association says that the disorder may appear first in childhood. This is a result of poor relationships with friends, doing poorly in school, and possibly social anxiety. These kids are teased and bullied for usually being known as odd, so, and they don't fit in. Some symptoms of the disorder usually begin in adulthood. So even though it may first appear in childhood, the symptoms don't really come around until later on. And it's more common in men than it is in women. The DSM-5 shares 7 types of context, in which PPD presents itself. So here are the 7. We're going to go over just a few of them, since even though there are 7, only 4 of them have to be met to be diagnosed with PPD. So let's say someone is diagnosed. Let's look at number 1. So suspects without reason that others are out to harm them in some sort of way. So this person has no evidence and only thoughts and feelings that someone is plotting against them or may even attack them. Number 2 is preoccupied with unjust doubts of loyalty. So even if someone does show their loyalty to someone with PPD, they can't believe it. They don't trust it. They know that if trouble happens, that this person is not going to have their back. They're going to use whatever they have on that person, that they're going to turn around and use it against them. So 3 is reluctant to confide in others. So they're afraid any information that they do share can be used against them. So kind of like I described in number 2, with being preoccupied with the doubt of their loyalty. So, they're not going to trust that person with any information because they could use that against them one day. So then we have, let's say, number 5, persistently bears grudges. So if this person was insulted, or maybe somebody said something that they perceived as an insult, they're going to have a really hard time letting that go and forgiving that person. Characteristics of someone with PPD. They are self-sufficient, so they don't trust anyone, so they're going to know how to take care of themselves. They need to control those around them, so the more control they have, the less harder it is. So they don't have to worry about trusting the others because they're in control. They have a hard time getting along with others and maintaining close relationships. So all this mistrust and the doubt of loyalty and everything, that's going to affect their work life, friends, family, partners. It's going to be difficult for them to have those relationships and keep them. And then these people are also at a greater risk for depression, substance abuse, and other disorders. So later on, when I talk about Mr. J's case, you'll see how his substance abuse disorder played into his diagnosis. So treatments can vary depending on what a medical professional believes is the best way to handle your situation. Psychotherapy can be used to improve social skills and develop trust. Different medications such as anti-anxiety, antidepressants, and antipsychotics can be used. Support groups, they aren't usually effective, especially, if you're trying to get them in a support group before or without any other kinds of treatment, because of all that mistrust and, the doubts of loyalty and stuff. It's not going to go well with them. So the American Journal of Psychiatry shared the case of Mr. J, he was a 65-year-old man. He was brought into the ER by police, and the police expressed concern for psychosis and delusions, said that Mr. J was easily agitated. He had no prior psychotic history. During his initial interview, he actually stated that he thought the hospital staff were out to get him. He was not fully cooperative during the interview. He was guarded, invasive, often said things like, "You don't need to know." So he didn't want to give them any information that they might use against him in some way. So the staff believed him to be mentally disorganized and paranoid. He later became loud, intrusive, and agitated. He even pounded his cane on the floor before throwing it down. He wanted to be discharged, but he was denied. He refused voluntary hospitalization, said he would sue if they'd done that, if they admitted him involuntarily. They did it anyway. It was due to the aggressive behavior and the risk of harming others. He stayed for 15 days, where he presented with verbal aggression, paranoia. He was easily agitated. He wouldn't engage with conversations with staff, and he refused any kind of treatment. So the staff was able to get a hold of his daughter, and she described him as a distrustful person. He always believed people were against him. He held grudges for long periods of time. He always had a suspicious way of thinking and aggressive behavior. Those came like in waves and patterns, and that's all part of the symptoms of PPD. So when Mr. J finally did come around, he told doctors about his increased cannabis use over the last few years, which explained some of his symptoms. So when he began to, go through all that detox of not having it, and, those symptoms started slowly going away, well, the paranoia didn't. That remained. So they knew they could start looking into treatment plans. They were then able to come to a diagnosis, and with Mr. J's cooperation, they started medication. He began showing improvements and became calm enough to develop a discharge plan with staff. When he was released, he was calm and cooperative, denied all psychiatric symptoms. They diagnosed him with cannabis-induced psychosis and underlying PPD. So they might not have caught the PPD without the information of the cannabis use and going through that detox, and they might not have came up with a treatment plan. So I've shared with you the criteria for being diagnosed, characteristics of a diagnosed individual, treatments, and the case of Mr. J. For more information, you can look through all the different DSM books, and by conducting your own web research, there are plenty of journals out there and different things you can look at. So thank you.